Good evening, everybody. Today we'll discuss something about lifestyle management after angioplasty. To bring you all on the same page, let's discuss a few points about angioplasty. First, angioplasties are done for patients who suffer from coronary artery disease. So, coronary artery disease is a form of disease which affects the blood vessels of the heart. What happens is there is deposition of cholesterol and cholesterol foam cells, macrophages. It's a long process which starts as early as the adolescent. Like when you are 10, 15 years of age, the process of atherosclerosis has started at that point, and it slowly worsens over decades. So by the time you reach your 30s and 40s, you have significant obstruction in your coronaries, and sometimes it presents as an acute episode with an heart attack, or as chronic stable angina when you have recurrent episodes of chest pain. So once you have a diagnosis of coronary artery disease, either it's an acute myocardial infarction, which means a heart attack, or chronic stable angina, you undergo certain evaluation which ultimately leads to the diagnosis of an obstructive coronary artery. That means you have a significant disease, deposition of cholesterol in your arteries that had required angioplasty. Angioplasty is done via either radial access, in which we go through the hands or the groins. Ultimately, we took a long tubular catheter and we hook it into the coronary artery, and we place a stent inside the coronary artery. Now in angioplasty, we treat only the vessel, only the tubular artery which is most diseased. We usually treat only arteries which have like 80 or more percentage obstruction. We do not open up arteries which have minor obstructions. And it has been very well established that most of the acute heart attacks, they don't happen only because of the significantly obstructed coronary arteries. They happen because of arteries which have only slight obstruction, like even 30-40% plaques may rupture and cause total obstruction. So your treatment does not end with the angioplasty, because the angioplasty only treats a single vessel. The process of atherosclerosis involves all the arteries diffusely, and acute heart attack can happen even with arteries who have minor plaquing. So what to do for them? Here comes the importance of continued lifestyle management. Now, lifestyle management broadly would have three components: management of your diet, management of your exercise and physical activity, as well as continued adherence to medications. It's not like you have an angioplasty and you are cured. There is no cure to coronary artery disease. You have to stick to strict diet, strict physical activity, as well as strict adherence to your medications. So all the three components are as important. You cannot ignore one and just keep on doing the other. So to discuss, let's start with diet. There has been a lot of conflicting opinions these days in social media and even scientific community. People are starting to spread rumors like there is no role of cholesterol anymore in the pathogenesis of atherosclerosis. There have been several reports, even publications. See, there is no doubt that cholesterol deposition in the coronary arteries is the cause of atherosclerosis. It is the cause of obstruction of coronary arteries. The vessels which get obstructed is because of the starting point is deposition of cholesterol. The point of debate is where does this cholesterol comes from? Now, most of the cholesterol in the body is not consumed in diet. Most of the cholesterol circulating in your body is produced by the liver itself. So even if you eliminate your dietary cholesterol totally, you would still have significant levels of cholesterol in your body, because the most important source of cholesterol for you is liver. The cholesterol is produced in your body. Now, why some people have high cholesterol levels and some people have low cholesterol levels? That is largely determined by genetic factors, the hereditary factors. There are a lot of genes, a lot of factors which cause increased level of cholesterol in some people, and some people don't have increased level of cholesterol. So diet does play a role, but diet alone is not responsible for your elevated cholesterol levels, and taking less dietary cholesterol does not necessarily protect you from atherosclerosis. Having said that, it does not mean that you can eat whatever fat you want. There are still a lot of factors which would influence your coronary artery disease levels. Like, two most important things that you have to avoid in fats is trans fatty acids and saturated fatty acids. Now, saturated fatty fats are very easy to identify. Any oil or fat which solidifies on room temperature, like 20-25 degrees, is saturated fat. Like ghee, dalda, any fat, animal fat, any fat which solidifies at cool temperatures is saturated fat. So you have to avoid that totally. Then trans fatty acids. Trans fatty acids are very hazardous. They have numerous adverse effects. Most common source of trans fatty acids in our Indian diet especially is reheated oils. Like, you use your oil to fry something and you kept the remaining oil and you reused it and you reused it. So even if the fresh oil did not have any trans fat, repeated reheating of oils oxidizes it. So reusing of the same oil to fry the pakoris again and again, that is a significant health hazard. And for that reason, the pakoris which you buy from halwai, which reuses the oils again and again, is an important source of trans fatty acids. So that has to be avoided. Apart from that, there are certain oils which have shown some benefits, like olive oil has shown some benefits, but the most of the benefits of olive oil are when it's consumed raw. If you fry, if you cook olive oil, most of its benefits are lost. So if you want to pick an oil, you have to pick an oil which has high concentrations of polyunsaturated fatty acids. So the unsaturated fatty acids is what you are looking for. Both monounsaturated and polyunsaturated fatty acids are good for you. Most of the refined oils currently available, they have monounsaturated and polyunsaturated fatty acids, but soya bean, sunflower oil, all those are good oils. Apart from fat, there are a lot of other factors in diet which are very important. Fat is not the only thing that you have to look for. If you want to broadly follow a single diet plan, there are two diet plans or types of diet which have shown to be beneficial from a cardiovascular perspective. One of them is the famous Mediterranean diet. A lot of people would claim, but the Mediterranean diet for us in the Indian scenario is difficult to follow because the two most important components of a Mediterranean diet is raw olive oil and wine and alcohol. A lot of people don't consume alcohol, don't consume wine, so we cannot follow that, and we don't consume raw oils. So Mediterranean diet is difficult to follow for us because of our cultural or food habits. The other diet plan is the DASH diet plan, DASH. It stands for Dietary Advice for Systolic Hypertension. DASH diet plan, it's basically there is no strict adherence of total amounts of calorie that you consume. What is more important is what type of foods you consume. So you have to consume legumes, cereals, nuts, whole grains, whole vegetables, fresh fruits, fresh vegetables. So more roughage, more fresh food, whole grains, cereals. Okay? Less of refined carbohydrates. Refined carbohydrate means in which the coating, the covering has been removed, like maida and things made from refined flour. This DASH diet plan would be helpful in controlling hypertension, in management of the dyslipidemia, that means the abnormal lipid profile in your body, and it will help you sustain a good cardiovascular health. Coming to the next component of lifestyle management, it's the exercise. Now, it's a misconception that people feel that I just had a heart attack, how can I exercise? You have to start physical activity even immediately after your heart attack. Of course, it has to be gradual and in consultation with your cardiovascular physician, your interventional cardiologist. But mobilization can be started as soon as depending on as possible, depending on your access to angioplasty. For example, if your angioplasty was done by radial route, you can walk from the cath lab to your bed after radial angioplasty. For after femoral angioplasty, since you can't move your leg, immobil of 6 to 8 hours is at least required. But almost all of the patients can be asked to move around on the next day, and they can resume their physical activity within a few days to a week span, depending on their symptoms. If all of their coronary lesions have been tackled and they don't have any residual significant obstruction in their arteries, or if they do not have any significant heart failure or rhythm disorder like recurrent VT/VF, they can be even allowed to undergo a unmonitored, unsupervised exercise program at home. But supervised exercise programs have shown to have better overall outcomes. Now, if you want to enroll in an supervised exercise program at any of your gym, or you want to do a bit more of intensive exercise training, it's better that you once get evaluated by a formal exercise testing at any of your healthcare providers, any of your cardiologists. The target that you should achieve or aim to achieve is an heart rate based. Now, everybody has a physiological maximum heart rate, which we calculate based on a formula like 220 minus age. That is an hypothetical maximum heart rate that we label a patient can achieve. Our target is to achieve at least 70 to 80% of that heart rate with an exercise program. But if you are planning, because now enrolling into an monitored exercise program, it's not only time intensive, you have to go to a gym or you have to take time out. It is also costly because if you go to a formal exercise training center, it will cost you something. So you can as well do an unmonitored exercise at your home. Now, if you don't have a treadmill at home or which has a heart rate monitoring facility, you can just monitor your symptoms. You have to exercise to the point that you feel slightly dyspneic. Now, perception of mild dyspnea equates almost comparable level of monitored exercise programs. So you have to exercise till the point you start becoming mildly dyspneic. But you should not reach this maximum intensity suddenly. You have to gradually escalate your exercise level. Gradually, if it's very much preferable if you can have any device by which you can access or measure your heart rate. Nowadays, it's commonly available. A lot of pulse oximeter, even cell phone based app can measure your heart rate, or smartwatches, they can measure your heart rate. So you should gradually escalate your exercise intensity so much so that initially for the first month, you start up with you measure your resting heart rate. When you are sitting comfortably, what is your average resting heart rate? And you target so that at your peak exercise, your heart rate increases to say like 20 to 30% of your maximum heart rate. Then you keep on building up your duration as well as intensity of exercise. Say by the next month, you reach to 30 to 40% of your resting heart rate, then up to 50% of your resting heart rate. So this is the gradual escalation of exercise, and it's of paramount importance. Now, for a particular session, once you have decided to exercise, any particular session of exercise in a day should have initial 5 to 10 minutes of warm-up period. You should not straight away jump on the treadmill. First, you should have a warm-up period. Warm-up period may consist of a simple stretching exercises, simple walking, or it may be also consist of slight weight lifting, like 1 to 2 kgs or 5 kgs of weight, which you are usually accustomed to. It will depend on your level of physical training. If you are accustomed of lifting 15 kg weight, you can use that. But by and large, it should be 1 kg dumbbell or small. Just a couple of sit-ups or slight warm exercises. Then you can jump to the next phase, which is the aerobic exercise phase, in which you can either use a treadmill, you can use an bicycle ergometer, or whatever form of exercise. A simple brisk walking or jogging is good enough. After 20, 30 to 45 minutes, the longer you exercise, the better it is. There is no upper limit of physical activity. The longer you can exercise, the better it would be from cardiovascular point of view. But a minimum session of 30 minutes per day has been shown to be good. So 5 to 10 minutes of warm-up period, 20 minutes of aerobic exercise, then 5 to 10 minutes of cool-down period. You should not straight away after your intense aerobic exercise period just lie down on the bed. You cool down, you resume slight walking, and then you rest. See, what is the benefit of exercise? Exercise trains your cardiovascular system to handle, to pump blood at a higher rate. See, angioplasty only treats your vessel which was significantly obstructed, but diet, physical activity, and other lifestyle modification, they treat the heart and the coronary arteries as a whole. Your arteries are not simple tubular pipes. They are not like PVC pipes used to supply water. They are very complex structures. They have multiple layers. The innermost layer is the endothelium, then there is then there is media, then there is adventitia. So endothelium is the most important structure. It consists of a lot of cells which are interlocked and they cover the whole artery. So a healthy artery has an intact endothelial lining. It covers the whole of the arterial surface. What happens with coronary artery disease, atherosclerosis? The endothelium, it becomes dysfunctional. It stops functioning. The cells, they get damaged. There is deposition of plaque, cholesterol, and it ruptures. It exposes a lot of atherogenic material, lot of thrombotic material. Thrombotic material means materials which promote blood clotting. So how does heart attack happen? Such a plaque which had diseased endothelium, which had a lot of cholesterol in it, in the plaque, it ruptures. It just like a balloon ruptures, and it exposes the atherogenic, the thrombotic material, and the flowing blood. It comes into contact with it, and the clotting factors, they are activated, and the blood clots, and the artery is totally blocked. It can happen with a lesion which is causing obstruction to the tune of 80%, or it may happen with an artery which has very minimal obstruction, 30 to 40% even. We cannot go on stenting all the lesions because it has not shown to improve outcomes. What has shown to improve outcomes is we stabilize these plaques. We make these plaques less likely to rupture. How would we do that? We do it by control of diet, by improving endothelial functions with exercise, and by certain medications. Here comes the importance of adherence to your medications. Now, one of the most important category of drugs which help you stabilize the plaques is statins. Statins are medications which lower your level of cholesterol. Now, that is not the only action of statins. Statins don't just lower your cholesterol, because there are a lot of other drugs which lowers your cholesterol, but they are not shown to be as effective as statins in plaque stabilization and prevention of recurrent heart attacks. Statins, they have anti-inflammatory effects. So they not only reduce cholesterol, they also reduce inflammation. So statins are very unique drugs. They are not just cholesterol lowering drugs, and none of the other cholesterol lowering drugs are as efficacious as statins. Most of the patients, not most, but all of the patients after a coronary artery disease, after angioplasty, are on statins for prevention of recurrent events, because we have with angioplasty only treated the lesion which was causing 80% obstruction or more. We have left a lot of other plaques. If there was an 80% obstructive lesion, then there are a lot of other lesions which are causing minor obstruction, which can rupture anytime and cause you another heart attack. For prevention of that, statins are a must. The other components are just in case some of the plaques do rupture, even after statins, they are antiplatelets, so-called blood thinners. They prevent blood clotting just in case some of the plaque they rupture despite statins, and they prevent thrombus formation and occlusion of arteries just in case another plaque ruptures. So antiplatelets are of lot of groups, but cornerstone is aspirin. It is an age-old drug. It's a very cheap drug, very simple drug, but it is most effective. To the tune that if you are having heart attack and you take aspirin timely, the risk of death is reduced by 1/4 just by taking simple aspirin. And to support aspirin, we have a lot of other drugs, clopidogrel, ticagrelor, a lot of other drugs. So basically, antiplatelets and statins. These are the cornerstones for prevention of recurrent events after you had an angioplasty. Now I see that some of viewers have asked me some questions. I will try to address some of them at least. First question is food to be taken. I think I have addressed this in when I was talking about diet. But in nutshell, lot of fresh fruits, vegetables, nuts, almonds, even walnut is good. Then fats, saturated fats are a strict no-no. Polyunsaturated fats are good. Fish is good. You can eat as much fish as you want because fish has lots of polyunsaturated fats. But there has been evidence, especially in the coastal areas, a lot of fish eating has other adverse events also, like mercury poisoning, especially in coastal areas of Japan. So ocean fish, you have to be sure that your fish is fresh and you should not get poisoned by fish as well. Then exercise to be done on a daily basis is the second question. Yes, of course. The more you exercise, the better it is. There is no upper limit of exercise. It should be daily, preferable. If for certain reasons you cannot exercise daily because of your schedule or anything else, as much as you can is good. At least 5 days a week, it's what is being said, but as much as you can should be the goal. Which foods to be avoided? Of course, red meat. Any kind of red meat should be avoided. Saturated fats, as I said, should be avoided. And the fourth question is, how will stenting reduce the risk of cardiovascular events? As I said, stenting tackles the lesion which had significant obstruction. So stenting would prevent recurrent event because of that particular vessel. So suppose there are 3 major arteries: left anterior descending, left circumflex, and right coronary artery. If there is a significant lesion in left anterior descending artery, we stent it, we open it. So the area of the heart which was supplied by that artery would get more blood, and acute heart attack in that area due to that artery would be avoided. But stenting would not protect the other vessels and would not protect the rest of your heart. So it is very important for you to adhere to your diet, physical activity, as well as medication for prevention of disease in the other vessels. How is angioplasty done? It's a very tedious thing. I unfortunately cannot discuss, but you just type this in YouTube and you will get a lot of good animated videos. And you can, if I find time, I will post some of those videos in this comment. How long in a day patient can walk after angioplasty? Patient can walk as much as you want. If you are not enrolled in a monitored exercise program, you have to assess your symptoms. See, if you are having angina on walking, then you should stop and consult your physician. Angina means chest pain or heaviness in chest. But you should walk up to the point that you start feeling mildly dyspneic, mildly short of breath. What are the risks of bypass surgery is another question. The bypass surgery carries a risk of on-table death, which is there with even angioplasties. It's less with angioplasty, more with bypass surgery. But bypass surgery has slightly better long-term outcomes. there is less need of recurrent revascularization. So whether a patient should undergo bypass surgery or angioplasty depends on a lot of factors. Largely, how many vessels are involved, whether the patient has diabetes, which types of involvement it is there. Not all the obstructions are same. There can be a vessel which is only 80% occluded, but it could be very tortuous, very calcific. There may be a lot of calcium deposition in it, and it would be a very poor vessel for angioplasty, but it would be a very good candidate for bypass surgery. So exact details of the angiography help us decide whether angioplasty is better or bypass surgery is better. But of course, there are certain subgroup of patients in which bypass surgery and angioplasties have equivalent outcomes. In that case, we explain everything and leave the decision on the patient. The last question is, does stopping medication and following healthy lifestyle will reduce the risk of secondary events? Yes, lifestyle modification alone does reduce the events to certain extent. But in addition, if you continue medication, there would be additional reduction of secondary events. But if you have undergone angioplasty, then you cannot stop your antiplatelets, because if you have a stent in your body and you stop antiplatelets, it is far worse than not having undergone the angioplasty in the first place. So after angioplasty, stopping drugs is not a possibility. Even if you haven't undergone angioplasty, stopping drugs is strictly unadvisable. But yeah, of course, if you don't do lifestyle modification and just continue drugs, the benefits are less. And same if you don't eat drugs and only rely on lifestyle modification, the benefits are less. I think I'll conclude today's session. And okay, I think there is another comment that I would address. Differentiation between heart, chest pain and gastritis. That is very important. And see, before going on to the actual descriptors of which pain can be more likely related to heart or gastritis, I will in a nutshell try to explain a simple Bayesian principle of pre-test probability. That means that we need to consider everything in the light of likelihood of a person having a particular disease. For example, there is a person who is 30 years old female versus a 60-year-old gentleman. The risk of both of them having coronary artery disease is drastically different. So if the same symptoms are there in a 30 years old female, likelihood that she would have coronary artery disease is very low. And the same symptoms in an elderly man, the likelihood is very high. So if you are at risk of coronary artery disease, any sort of symptom should not be ignored. If you are beyond 40 years, if you are a smoker, if you have diabetes, if you have hypertension, if you have elevated level of lipids, if you have strong family history of MI, you should not ignore any sort of symptom and contact your healthcare provider. But otherwise, chest pain, which happens due to exertion, which is there with walking, is largely cardiac. Any cardiac chest pain can have any location starting from your umbilicus to your neck, jaw, both upper limb. Strict relationship with diet does not help in distinction. Even chest pain due to heart disease can be worsened with food. That is called postprandial angina. So if your pain is worsening with food, does not mean it's due to gastritis. Sometimes it's very difficult to differentiate whether the chest pain or heaviness is due to gastritis or due to heart disease. So it's better not to ignore your symptoms and contact your healthcare provider. Thank you.